Hi, I'm Allison Walker. I'm an RN here in cardiac rehab at Mills. Phase 2 rehab is for patients who have had a recent heart event, being heart attack, CABG, PTCA stent, valve replacements now covered. It is insurance covered. Medicare and most private insurances will cover this therapy. Phase 3 is heart health. It's considered heart health. So it's for patients that have gone through phase 2 and they've already graduated, or for patients who have a heart history or risk factors for heart disease, such as high cholesterol, overweight, diabetes, high blood pressure. So during the phase 2 program, patients are educated in their risk factors for heart disease, and we counsel them on diet, on the exercise, on smoking cessation if they're smoking. If they have diabetes, we go over their diabetes and make sure that they're following a correct diet and following their A1C and their blood sugars, monitoring them as they should. And during their exercise program, what we do is we start them at a level of exercise that is determined by what they've been doing at home and what their stress treadmill test, if they had one, showed. And we build from there, and it helps them increase their strength and endurance. We see blood pressures decrease. We see heart rates usually decrease with exercise as they go along, but we have a target heart rate that we try to get them up to help strengthen the heart and the heart muscle. And like I said, we build on this program over, depending, their risk stratified, and they either come for 12 visits, 24 visits, or 36 visits, and during that time we're increasing all of those workloads and times and monitoring their hearts. We watch they're on a monitor, we watch their heart rhythm and rate, and let the doctors know if there's any problems going on. We send progress reports to the doctors. So the patient is really micromanaged by us and the doctor. And then we help them start a home exercise program at the same time that they're doing their program here, so that they're exercising 5 days a week total as a minimum. We weigh them, keep track, help them lose weight if that's one of the things that needs to be addressed. So in the phase 3, or the maintenance program, it's really just a continuation of that program, but by that time they're more independent, so the patients know their routine and they go through their routine, and we monitor heart rates and blood pressures just like we do in phase 2, and we continue to send progress reports to the doctors. In both those programs we also review medications with the patients, go over what the medications are for, give them information on it. If there's changes, we review the changes with them. And again, during the maintenance, if there's a problem going on, we can send a note to the doctor and alert the doctor, so we're working closely with their physicians all the time. And it helps them, keep their blood pressures under control, their heart rate under control, keeps them in their target heart rate so they feel safe if they do exercise on their own. It keeps them aware of any changes that have occurred in the news or in healthcare concerning any procedures or changes in cholesterol or changes in medications. Maybe there's one they shouldn't be on, maybe there's a better one, and we can give them a little hint to talk to their doctor about it. We send progress reports to the docs still every 3 months. So, but it's more independent, so they already feel comfortable with their program. So the type of training that we do, it's called circuit interval training. And what we do is we always alternate leg and an arm exercise. So most patients will do, start with a treadmill. And we build them up so they're doing a minimum of 10 minutes on a treadmill. Then they get off the treadmill, take one lap around, get some water, and then they'll go to an arm exercise. Either an arm bike, a rower, free weights, wall pulleys. And they'll do, they work up to 5 minutes on the arm. Then they again take a lap around and they'll go to another leg exercise, and most of them go to some type of a bike. We have recumbent bikes, we have upright bikes, we have what's called a sci-fit, which is kind of like, if you know what an elliptical is, it's like an elliptical but you're reclining, so it's easier on the knees and the hips. We have a new step, which is for people with orthopedic problems, like problems with knees and hips. It's a little gentler. So we have lots of equipment that helps with orthopedic problems. So they'll do that for 10 minutes and then get up and walk around again and go to another arm exercise. And it'll be one of the pieces of equipment I just mentioned. So they do a total of 6 exercises, alternating legs and arms. So it's 3 legs and 3 arms. So they're working out. We count their warm-ups and their cool-downs as part of their exercise. So they work out for 60 minutes.
Taking